Probably have time for one more question.
One more question.
Hi, I'm Jessica Shore-Saxon. I'd like to comment on a couple of things that were said earlier and then talk about the system.
So Jessica, you're a capitalist or a socialist?
Aha, I'm going to address that. So I'm a selective capitalist. Thank you.
I knew the answer to that.
What?
I knew the answer to that beforehand.
You knew I was a selective capitalist?
Yes.
Okay, well, I'm a selective capitalist. I think that there are things like buying shoes which are amenable to capitalism. I think there are things like education and like healthcare that are social goods. And that they're not really amenable to capitalism in the way that people understand capitalism. So I want to pursue the system question, and I want to point out that there were a lot of things in the movie, and there were a lot of things about delivery of care and so on. Started out with pointing out that the United States spends twice as much per capita as other countries, and that our statistics are terrible. And not only do we know that they're terrible, but since that movie was made, the Institute of Medicine came out with a new study of international comparisons, which shows that the statistics are even worse. And in the foreword, the preface, they say the committee was not prepared for how bad our numbers are. And these are mostly specifically looking at health statistics in people under the age of 50, because that's never been separated out. Now, the countries that do better all have something in common, and they have systems of universal care. And when you have universal care, then you don't run into some of the questions that have been raised here about, like, why are we having health fares that people who are uninsured drive 300 miles for? Or why in a county that does relatively well, like ours do, the question that Mike Doolin raised about why do we have so many people who can't get care? That's one of the things that you can address. Another thing that you can address is something like the whole issue of the delivery of primary care, because you can plan for it. All the issues that we're talking about what gets funded, if you have a unified system, then you can actually have somebody who says, well, we're going to base this on comparative effectiveness research, and we're actually going to have some rational ways for how we fund this. And, you know, Alan, you made a kind of joke about whether we'll see this in our lifetimes unless our current system implodes and gets even more over 18% of GDP. But that's the direction we're headed in. And the Affordable Care Act is not going to make that better. The Affordable Care Act is going to make that worse because it's going to be more expensive. So I guess I have a question here, which is, speaking of systems, I mean, really, how do you all think that we get to a better unified system? How can we hope to do that?
Well, that's the million-dollar question. Well, in this case, it's the billion-dollar question, or trillion-dollar question. Let me take a whack at that, because I was joking, but I'm not. And if we don't get this right, we may not get to universal health care. What we'll get to is regulatory price control. That's what it will come to. And just speaking from reality, that's not going to be fun either. So we've got one shot at it. So let's use the North Carolina Medicaid. We've been said we're going to have a flat payment over the next 2 years. We're still talking they just started budget writing. So my challenge to you: how are we going to continue to have flat growth rate in Medicaid? Well, there's things like, well, if we want to do more and cover more people, we're going to have to pay for it out of what we got now. So how are we going to do that? And it's the power of all of you. We just looked and said, gosh, what would happen if all our networks and everyone in North Carolina performed better, right? Performed as good as our top 3 networks as far as the growth and how we did. That people paid attention to the details of the patients. How much money we would save? How much would you guess? $400 million a year. Additional savings on top of that. So it becomes very additive. Yeah, I guess what I'm saying is the collectiveness of all of you and the fire you have lit is really at scale pretty damn impressive. I'm sure Anita will be telling you about, the chronic pain initiative and the high frequent ER patients. Some of the people you're seeing here, the new thing we're going to do in mental health that put people in there and intercept these people who go to the ER hundreds and hundreds of times a year because no one pays any attention. They just saw them. This is hard work. This is one patient, one community at a time. And I think, to your point, that's the only way we're going to get there. And when we prove we can do that, I think then that's the next, then you have the credibility to say, we're going to pay for prevention. They're going to let us do anything we want. When we can prove at scale we can do it. And in structure, it doesn't matter. It can be in systems, it can be collaborations of people. That's the only thing that's going to move this needle. And it's not, we can't do ACOs fast enough, we can't do structural to move this unless we all collectively figure out the low-hanging fruit. So I'm preaching the choir. I'm preaching specialists and our specialist colleagues now saying, you got to get in this game. If you don't in the next 2 years, then it will be done to us, whatever it will be. And so it really is up to the people in this room to, and I can't, I didn't invent any of this really. I mean, thanks, John. But it's the collection of people saying, well, I know what I could do in my community if I had just a little bit of a, run and start on this. And that's how we built the whole thing. And so I say to you, why not? Let's light a few more fires and see if we can get this thing moving. We're going to stop. Thank you, Anita and Dr. Baker, and thanks for the panel, and thanks for all of you for what you did.
Thank you all for coming. I don't know if this is on. Yes. Thank you so much for coming. I mean, I'm glad the weather didn't chase anybody away, and we are happy to partner with anybody. Matter of fact, I'm looking around, and I don't see many people we don't partner with, and that's awesome. Let's keep at it and keep the conversation going. Thanks for being here.